everyone can hear me. So is that okay? Yeah, perfect. Okay. So I'm Dr. Shpiner. I'm from University of Miami, and I'm very honored to be here to talk to you today about a topic that I think that we as your doctors probably don't talk with you about enough, and that is about advanced care planning in Parkinson's. Okay, so when we talk about advanced care planning, what we're talking about broadly is just thinking about what you want for the future. So this might be in terms of specific medical interventions that you may or may not want as your disease progresses. And it also includes thinking about who you might want to make decisions for you if you ever find yourself in a situation where you can't make them for yourself. So I'm going to start by asking, who should be having these conversations? And the answer really is that probably everyone should. At very least, I think everyone in this room should be thinking about, who you would want to make decisions for you if you couldn't make them for yourself, because accidents can happen, emergencies can happen. Any one of us today could leave here and end up in the emergency room for any number of reasons, and we may be in a situation where we're going to rely on someone else to help make our medical decisions for us. And then definitely people who have a serious health condition like Parkinson's and many others that might cause them to be in a situation where they can't make their own decisions. And I also want to emphasize that I don't think this should be a one-time task that you think about once, come up with a plan, and then never think about again. Ideally, this is the type of thing that you want to start thinking about early and then revisit at least annually or when there's a significant change in your disease progression. So I think a good starting point for thinking about this topic is thinking about your goals. So when we talk about goals of care, this can mean a lot of different things. So maybe your goals are curing your disease. Maybe your main goal is to prolong your life for as long as possible. Maybe it's to maintain your current level of functioning. Maybe it's about supporting your loved ones, like financially or physically, because maybe you're a caretaker for someone else. Maybe your main goal is just to relieve your symptoms or your suffering. Or maybe your goal is to make it to a special milestone, like a graduation or a wedding or a birth or a retirement or something like that. Or maybe it's just to have enough time to make peace with your family, friends, or God. So what is an advance directive? So this is basically a way that we tell other people what you want if you lack the capacity to make a medical decision. And we'll talk about capacity in a minute. But officially, and when we talk about advance directives, what we're talking about is a written statement. So a document where you have written down your wishes regarding your what you'd want for your medical treatment, or again, who you want your decision maker to be, that you might fill out to ensure that your wishes are carried out in the case that you can't communicate them to your medical team. So what is capacity? So from a medical perspective, capacity essentially means the ability to make a well-informed decision. So in medicine, we consider someone to have capacity if we know that that person can fully understand the treatment that we're talking about and what are the risks, the benefits, the alternatives, and the implications of making the decision one way or the other. This is something that for us is very time and question specific, which means that you might have the ability right now to answer a complex question, but maybe not tomorrow, or vice versa. Maybe, you have an acute illness or an infection, you're a little bit confused now, and you treat that and you get better, and then you can make the decision later. So this is something that might change over time. It also is question specific. So a person may have capacity to make one decision, but not another. So for example, maybe someone who's ill or has significant cognitive problems may be able to answer a question about who they trust most in their life, even if they can't fully understand the details of a medical procedure and make that decision for themselves. Okay, so what happens in a situation where a patient lacks capacity to make an important medical decision? Well, ideally, if you have advance directives, your medical team will follow them. Usually this also involves finding a surrogate to help the healthcare team figure out what the patient would want to do in a particular situation, because advance directives, living wills are great. You usually can't think of any possible scenario that could happen when you prepare them. So almost always we also need a person there that can help us make those decisions. So ideally this person should be a healthcare proxy. And when we use this term, what we're talking about is somebody who has been specifically designated by the patient in advance to be their chief decision maker. So this person has legal power to make decisions for the patient if and when he or she cannot make them. And this person has almost as much legal power to make medical decisions as the patient. And the discussion when we're talking with a healthcare proxy is always about the healthcare proxy's job is not to tell us what they want for the patient or what they would want for themselves. Their job always is to tell us what they think the patient would want if he or she could make the decision themselves. Okay, so how do I pick a healthcare proxy? So ideally, this should be somebody who knows you really well, who cares about you, and probably most importantly on this list is somebody who you really trust to carry out your wishes. And then going off of that, this is also someone who then should be well informed with regards to your goals and wishes. So I think once you decide who you would want this person to be, the next step is to make sure that they really understand what you want. Okay, so then how do you decide what you want? So I think a good starting point here is to think about what your goals of care are. So this might start with you thinking yourself about your values, maybe experiences from your own life or from the life of someone that was close to you and what their experience has been with the medical team and with medical treatments. And it may also be important to consider what your current health status is. And then once you've had a chance to think about all of those things, I also strongly advise you to talk with your doctor and other members of your healthcare team. And again, just to reiterate, this doesn't have to be static and really shouldn't be. So this is maybe something that you think about now, but maybe in 6 months from now and 10 years from now, your thoughts on this subject may change quite a bit. So this is something that should be revisited frequently. Okay, so now for the really hard stuff. So I get a lot of questions from patients about code status, and I think this is a medical term that we kind of throw around, but maybe patients don't always fully understand what we're talking about. So code status designates the type of emergent treatment a person would want to receive if his or her heart or breathing were to stop. So when we talk about when we use the phrase full code, what we mean is that the person would want us to perform CPR, and if they stopped breathing, to also insert a breathing tube and hook them up to a ventilator or a breathing machine if necessary. So if your code status is designated as DNR, that stands for do not resuscitate. That's an indication to your team that if your heart were to stop, you would not want CPR performed. And if you hear the term DNI, this stands for do not intubate. This means that the person would not want a breathing tube inserted and would not want to be hooked up to a ventilator. So I think one interesting thing to keep in mind when we're talking about CPR and code status and all of this stuff is, to think about the times when these procedures are performed. So CPR is performed in the case that someone's heart stops beating. But one thing to think about when you're thinking about code status is to consider what happens when a person's heart stops beating. So it might be a medical emergency in some cases, or in others, it might represent the natural end of a person's life. And that might depend on code status. So something to consider is, someone who's 20 and healthy might, if their hearts were to suddenly stop, and they had CPR performed, they probably have a reasonable chance of having a good outcome. Someone who's 110 and very sick could have CPR performed, but the chance of them going back to how they were before maybe isn't that great. So, and thinking about that and those kind of predictions might help that person decide what is the code status that they would want for themselves. I think where it gets tricky is probably for most of us in the room that we fall somewhere between those examples. And that's where it gets hard. So one other thing I just want to leave you with, a thought to consider, is that CPR is a medical procedure. So it has risks and benefits with it like any medical procedure. So potential benefits, you may live where you otherwise may have died. Pretty good, right? But it has some potential risks too. So you may live, but you may not, you may end up in a place that you really didn't want to be. Or you also may miss out on a chance to die gently surrounded by loved ones. And if that's something that's in line with your goals of care, maybe that's something to think about when you're kind of thinking in general about what you want your wishes to be. Okay, so say you've spent the time, you've thought about all of this, You've talked with your healthcare proxy, your medical team, and you have a really good idea of what your wishes are. How do you make sure that they get carried out? So the first step is to make sure that you do the paperwork. So you definitely, if you want to designate someone as your healthcare proxy, fill out the healthcare proxy form. If you have specific ideas about what you want for your care, fill out a living will. If you have specific wishes with regards to code status, like we talked about, you may want to consider filling out a form called a POLST form. So this is a physician order for life-sustaining treatment, and it's actually a physician order. It has to be signed by your doctor, and it counts as any other medical order and can specify what you want for code status, artificial hydration, and nutrition. So kind of like the big things. This paperwork is something that you fill out now, but I also want to reiterate that this kind of paperwork is only used in the case that you find yourself that you're in a position where you can't make the decisions for yourself. Otherwise, the default is that you make all your own decisions, and the forms aren't used unless they're needed. So you have the forms filled out, and so what do you do with them? So I would say the most important thing is to make a lot of copies. Make sure that your healthcare proxy has one. That's probably the most important person to have a copy, but also give it to your primary doctor, your neurologist if you have one. And if you ever have to go to the ER or the hospital for any reason, make sure that you bring the documents with you. And then one thing I learned about actually when I was putting together this presentation is that actually EMS personnel are trained to look on the refrigerator of your house or condo for POLST forms. So if you have specific wishes with regards to code status or some of those other kind of big items, and you should definitely fill out the form and then put it on your refrigerator, because they're actually trained to look there when they respond to your home for a medical emergency. Okay. So at this point, you might be thinking like, wow, these are some very uncomfortable topics. I don't really want to think about this. I'm not sure I really want to talk with my family about this. So why should I even be thinking about this? And I can tell you, I think there's two reasons why it's really important. And I also come to you with the perspective that in addition to my work in the movement disorders outpatient clinic, I also spend 8 weeks a year as the attending neurologist for the general neurology team at Jackson Memorial. And I often in that role find myself on the other side of these conversations. So I often find myself in the situation where I'm in the hospital talking to families in a situation where a patient lacks capacity to make decisions. So number one, I think this is important because having these discussions, thinking about this, filling out this paperwork is the best thing that you can do to guarantee that you receive care that is in line with your goals if you ever find yourself in that situation. And the second reason that I think is also really important is that going through this process, as difficult as it is really a gift that you can give to your family and friends. Because if you ever find yourself in the hospital in the emergency situation, there will be no question among your family and friends who is the designated person to act on your behalf. And you will also be removing a huge burden from them with regards to making the really hard decisions. And I can tell you that I've been in a lot of family meetings, and if the person has an advance directive versus not, the way that those meetings go with families, it is night and day, regardless of what the patient's wishes are. If they want really aggressive care or they don't, it's very easy for family members to be in that position and say, listen, I don't even have to think about this. I don't have to agonize over this decision because I already know what she wants because she told me. So I encourage you to think about it for those two reasons. Okay, so I want to wrap it up here, but I want to leave you with some resources, regardless of where you kind of fall on the spectrum right now with, if you're just getting started with thinking about this for the very first time or already ready to sign paperwork. So the Conversation Project is a website that helps give you some guides with how to kind of start these conversations with your family. It gives you some guides, for yourself to use to think about goals, think about, how to approach these topics with your family or, how to approach somebody that you may want to serve as your proxy. So this is a good starting place if you're kind of starting from scratch. So say you've already kind of figured out your goals, your wishes, and you're ready to start filling out some paperwork. So this is another website called Prepare for Your Care, and it actually gives you a very easy step-by-step guide to help you fill out healthcare proxy and advanced directive forms. So this is also a good resource. And then the last one, if you have specific thoughts about your code status and you're ready to fill out the POST form, there's actually a, these are actually state-specific forms. So there's this postfl.org will give you a link to the documents that you need for the state of Florida. And again, remember that this one's really important because this one also has to be signed by your doctor in order to be considered a medically valid order. Okay, and that's the end. Actually finished at 4 o'clock.